Today is Sunday evening, April 26th. Today, Gabe and I finished our second day, 2 of 7 of the New York City tour of duty. Coronavirus, Gabe volunteering from his cardiology job a week, and me coming out from California. Yesterday was really just orientation and getting badges, kind of getting a little bit of a lay of the land. But today we each rounded with a resident and had about a half service of patients, and dug in and saw some people and really started to get into that front line in medicine, in coronavirus medicine, COVID medicine, of the realities of, death and recovery, of healing, of medicine, of mistakes, and no visitation policies, and patients being alone, and people being stuck in the hospital, and people recovering and going home, and all of the ups and downs and victories and defeats and kind of joys and sadness of life, and of medicine, where I think it brings so many themes of life out. There's a couple stories I want to tell you today. I thought, kind of the overall feeling was, I thought that this would be a depressing, horrible, kind of death-filled, hard, challenging, war-like time. And today, so many things have me feeling the opposite: inspired, energized, hopeful, even in the midst of this fucking terrible pandemic where people are dying and suffering. I'm feeling way better than I thought, and renewed, and I'm not exhausted, and I'm excited to go back and be more of a part of this thing. I got there in the morning and started rounding with Dr. Cito, who is an intern, just graduating medical school a year ago, a family medicine intern, and we had 7 patients that we talked about today and took care of. She did a great job. She was a great intern and taking care of people. And one of our first patients, we discussed, and you sit down in the doctor workroom and talk about these people literally on paper, and their names and ages and medical conditions, and what complaints brought them into the hospital, and what the results of their tests are, and what medicines are on, and how they're doing. And one particular patient, some people look better than others. Oh, they're getting better. They require less oxygen. They're getting closer to going home. Others go the other direction. They require more oxygen. Now their kidneys have failed and are shutting down. Oh man, now their heart looks worse. Their x-rays getting worse and are kind of going the other direction. And one patient that for some reason didn't register as much when I was just looking at her on paper, was an older female, 86, who came in from a nursing home and basically got COVID was exposed in the nursing home. Somebody got it there, gave it to her, and she came in a day or two before today, pretty sick. She had the classic respiratory failure with low oxygen level, looked like pneumonia, but being 86 and having other problems, she had had a stroke before and high blood pressure, and a lot of medical conditions that had left her really not in a great shape for 86, but she wasn't bad. She had her daughter, had kind of told me, despite being in and out of the nursing home, had a reasonable quality of life. And when we got her this morning, she was DNI. They didn't want dialysis, so not only had COVID caused her lungs to fail, for her to have problems getting in oxygen and having, this form of respiratory failure, but her kidneys had also failed pretty severely, not just a little bit. And it's something that really needed dialysis. There's four of the most common reasons you need dialysis when your kidneys aren't working. Is number one is fluid. So your kidneys just aren't removing fluid, and people swell with fluid, which most of the time looks like fluid in your lungs where you can't breathe. This wasn't her. Second one is your potassium goes up very high. Normal potassium is 3.5 to 4.5 or so. You start to get into trouble when it's 5.5, 6, 7. Hers was like 8. How she was still alive. What happens when your potassium gets really high like that is your heart goes into an irregular heartbeat, an unstable, irregular heartbeat, which can lead to cardiac arrest and death. Be very, very serious with the high potassium. Similarly, the kidneys maintain acid-base balance, and if they don't work, someone can become acidotic, which can lead to many other problems, including cardiac arrest. I had a patient a month or two ago who was incredibly acidotic. pH was 6.8. It was from respiratory failure, different kind. It was asthma respiratory failure, but they ended up having a what's called a VTAC arrest. We had to shock him. We got him back, but eventually acidosis ended up killing that man, and that wasn't something that needed dialysis. And the other one is called uremia, where BUN and creatinine, some of these toxins, the kidneys filter gets so high that you're altered, that you're confused, that you're out of it. And so those are the four things where we put people on dialysis when their kidneys aren't working. If it's short of that, usually you can manage it in other ways and watch it. You don't have to do dialysis. She was at a point where she had 3 out of the 4, which is just really severe. And if she wasn't 86 and in poor health, would have gotten dialysis. So many people end up getting dialysis from coronavirus, and that's part of the sickness. I mean, how many times do people end up on dialysis from influenza? It's not comparable. So she's really sick, respiratory, lung failure, and on paper, I appreciated that, but it looked like, her labs were kind of hanging in there. It was okay. Maybe she'll turn around. They had done all the right things treatment-wise, and I don't know. It just didn't. She did look really sick on paper, but it just didn't register until we went into the room. So we get all the PPE on, donning and doffing, like putting on this hazmat suit. I'm like stepping into it, and putting on the mask and the gloves and everything. So we go into the room, and it's a sweet little lady, but she's unresponsive. Barely. You go in and you talk to her and you touch her on the shoulder, and she just doesn't respond. And when I saw that, combined with knowing how severe her labs were, and that's when it hit me. I'm like, this lady's dying. She's not gonna, unfortunately, recover. This is too far gone, and there's nothing we're going to be able to do. Giving her dialysis is not going to change this. No treatment, really, of any kind is going to change the unfortunate reality, which is she's dying of coronavirus. But it really hit me seeing her in the bed, virtually unconscious and frail and sick and breathing fast, and with the oxygen and everything on her. And, we made the decision So I talked about it with Dr. Cito, and the patient was already, what we call DNR, DNI, do not intubate, do not resuscitate. They had ongoing conversations with the daughter about how sick she was, and the daughter understood, what was going on from what was written in the chart and what was signed out to me. And so we kind of made the decision that given all of these things, that really the reality was this patient was dying, that the right thing to do was not continue to treat her full court press, prolong her life and prolong her suffering, but rather to give her a peaceful death. And so I called the daughter and spoke with her at length on the phone, and got to know her and the patient, and the daughter had taken care of her. She was her caregiver for years. She'd been with her, through ups and downs, in and out of the nursing home. She'd really done an admirable job caring for her mother, which is not easy. And she knew that she was getting worse over time, and she just knew it was her time. She had a feeling, this part's where this just got sad for me. But she hadn't seen her mother in 2 months because of Corona. So the nursing home that her mother was staying in had been closed to visitors for, exactly this reason, because they didn't want to get Corona in there to get people sick, and then it goes around the nursing home and they all get sick, and then they end up dying like this woman did, So appropriately, the nursing home's like, sorry, no visitors, but then she can't see her mother. Folks are lonely enough as it is, and then this just makes it harder. So she hadn't seen her. She knew something was wrong, and she hadn't. Hang on just a second. I'm actually getting into an Uber. Hi, Alexander?
Yeah.
How you doing? Would you mind turning the music down for me just a little bit?
Yeah, no problem.
Thank you very much. She knew. She just knew, and she wasn't sure exactly what was going on. She had a lot of frustrations and was, mad because she had come up before and wanted to see her, and they wouldn't let her in because of the visitation policy, which in the visitation policy at this hospital was no visitors, period. That's it. And so I had talked to the charge nurse who was running the floor, and she was a good nurse. She knew the patient. And I said, hey, she's getting close. Not in the next couple hours, but maybe a day or two. She's probably going to pass. I'd really like to get the daughter in there, and for the daughter and for the patient, so that, the daughter has some moments to see her and to say goodbye, and so the patient can at least feel, even though she's altered and confused, I think at some level she would feel the comfort and the presence of her child. These end-of-life issues are so much more difficult when patients are isolated like this because of this disease. And I think the isolation policies are appropriate because we don't want to spread it. But I also think that there needs to be a policy that can accommodate visitors safely, especially in these end-of-life moments that are so important. So important. I've been with enough people at the end that God, to do so alone, truly alone, it's horrible. It's awful. So, we had identified that as something that was important for us to do today to, number one, acknowledge and kind of witness that this woman's dying. And it's not because, we, the all-powerful doctors, are going to let her go, but rather, we're acknowledging the reality and the truth of what's going on despite anything we can do against it. We certainly could have dialyzed her, put a very large catheter in her neck to run all of her blood through a machine to keep her alive longer, to keep her body alive longer. And she probably would have lived a little bit longer, and then she would have died. And I think most of us who are, of right mind and don't want to go that way, if it's our time, we want to, be let go gently and peacefully and in the presence of someone that knows us. So the charge nurse was willing to work with me on that, and we came to an agreement that the patient's daughter could come and visit and get all gowned up and put the appropriate protective gear on and go in and be with her mother for one last time. And she did. I talked to the patient's daughter, and she came up, and I got a chance to meet with her. Dr. C2 and I spent some time with her in the room with her mother and got a better sense of who she was and how she had emigrated from another country and had I think it was 10 children, and had come to this country and given them a better life. And you could see the daughter, loved her mother, and there's certainly a sadness in death, but I think that we were able to do this was a very good and really a beautiful thing for this family. We couldn't save her. We couldn't stop COVID from killing this woman, but I take great meaning in what we were able to do for the patient and her daughter and her family. So even though, I just don't think it's a loss. I think it's I see that as good medicine and a victory, and part of what it means to be a good doctor in this god-awful pandemic. So that was the first story, and that one's heavy. I don't mean to hit you with it, but this is the reality of this stuff, and I think you can see I'm kind of through the clouds. It's not unclear to me. This was a beautiful moment, and I'm going to give you a good one. I'm going to give you a happier story. We had another patient that was young, 23, and she initially came in with chest pain, and chest pain that was worse when she took a deep breath, and it had developed over the course of days to where she got short of breath going upstairs. And when she was admitted, she had all kinds of heart problems. Her EKG was abnormal, and her heart enzymes were elevated. Troponin, 1, 2, 3, as high as 3.5, I think, which are very elevated, suggesting like she could have a heart attack. Like if you weren't looking at coronavirus and you saw this EKG and this blood test, you were like, God, is she having a heart attack? They did an echocardiogram of her heart, which is an ultrasound of her heart, and noticed that her heart was beating only at a fraction, maybe half of normal. So she had developed a heart failure syndrome around this chest pain and shortness of breath. Oh, of course, all in the context of this coronavirus pandemic. And the interesting thing was her COVID test was negative. And she had had a family member with a history, a sister who died in her 20s of cardiac arrest. So, the echo also showed that her mitral valve, one of the valves in her heart, was seriously leaking blood backwards. Blood was flowing the wrong direction. And at this point, one of the thoughts was, well, she needs to go see a surgeon and have her valve fixed. But, this really didn't make sense to me, because everybody in the hospital has coronavirus. Like, the first thing that I'm thinking is, gosh, all of this stuff is related to a complication of corona. And I had heard about coronavirus, the virus affecting the heart. A viral infection of heart muscle is called myocarditis. Myo means muscle. Cardio means heart. Itis is inflammation. Inflammation of heart muscle from a virus. Viral myocarditis. If the lining around the heart is called the pericardium. If the pericardium is also inflamed and infected with the virus, you would call it viral pericarditis. So this, I was like, it just looks like myocarditis and pericarditis to me. I don't think she should have surgery. And so we reviewed the case. I reviewed the case with Gabe, who's a cardiologist. Took him through the EKG. We looked at the echo. We kind of really got into the case and kind of broke it down. And the first thing he did was he looked at the EKG and he said, no, this is not a heart attack. And here are the subtle reasons why. I mean, this guy is an incredible expert. I mean, cardiologists, I look at a ton of EKGs in the ER, but these guys are the real masters of that. And it was really cool to watch my buddy in action just break this down and ultimately confirm my hunch, like my intuition, which was, this is from coronavirus. And I think this is if she gets over that virus, she's young, she's going to recover, like she's going to be okay. She should not get surgery. We looked at her echocardiogram, and when you looked at the fine details, it really appeared like, her heart muscle was affected. It was dilated. It wasn't squeezing and pumping like normal. But when you looked closer at the valve itself, there's nothing wrong with the valve. But rather, it was that the heart was kind of pumped up too much like a basketball, and so that was kind of spreading that valve thin, and so it was creating a little hole. But there was nothing wrong creating kind of a space between the two valve leaflets, as opposed to there being something actually structurally, intrinsically wrong with the valve, which really there wasn't. So valve surgery wasn't going to do anything to fix this. She needed to recover from the virus. So, but then the other problem was, well, wait a minute, the test was negative. Again, like I've done this long enough, like forget the test, like look at the clinical picture, which is 90% of the people in this hospital ward had coronavirus. And it's just too unlikely that a 20-something-year-old woman that came in with what really appears to be a viral infection of her heart, that's so incredibly rare, that is not, in the middle of this pandemic, coronavirus myocarditis. It's just so highly unlikely that's what she had. And so we reviewed the whole case and everything and come to this conclusion: we really shouldn't send her to surgery. She's okay to go home. She didn't need oxygen. Her symptoms were better. Her heart was better. She still needed to recover and see a doctor in the next month or two, but that she was okay to go home. So I went in and talked to her, and this is where the story just gets even better. I get to know her a little bit, and she was the middle child of 7 first to ever go to college. I think she went to college in Georgia or something, graduated, and now she was involved in grad school at Columbia to be a social worker. She wanted to help people. She wanted to help. I think she wanted to help foster children. I forget, what the exact way that she wanted to help was. But then also she wanted to go on and get become a lawyer so that she could further advocate for people. And to be a part of, at this point they had already treated her. They had done a great job. I didn't do much. We sorted out that she did need surgery, but they had taken care of her corona and treated her appropriately. She got all the meds and everything, and she had gotten better to a point where she could go home. It was really cool to see not only somebody recover and, do well and be able to go home, which was all great. Thank you very much for the ride. Okay, all right. Gracias, adios. That was all awesome, because that was awesome. But to think about how our care of her, this person who not only gets her own life, and so what if she would have ended up being somebody who would get her whole life and be able to go and work at the corner store again. That's still a win. But there was something that really inspired me today about, this ripple effect of someone who, here's somebody who is, she's an inspired person. She wants to do something with her life. She's gone to school. She's already accomplished some great things. First person in her family to go to college. She's working on social degree. She wants to help the world and go on and be a lawyer. And we were part of something that saved her life. Who knows what she's going to go on and do in this world, because she's still alive and she's still able to affect that mission. Who knows who she's going to help down the road. That was really fucking cool. And I have no idea what she'll do or how that will play out and live on. But what a contrast to really helping a patient have a beautiful, peaceful death where her daughter can still connect with her and have those moments of goodbye and that kind of conclusion. And then also a different kind of victory, one where somebody's going to live on and do good in the world. It's like, holy shit, this medicine stuff is powerful, and it's powerful every day. But this corona pandemic thing really brings these themes and these messages and this stuff to life. It really elevates and it puts it out there for you in such a way to see and appreciate and feel and take in and embody and sink your teeth into. And so I had thought that this would be an exhausting tour of duty and a brutal, in the trenches, hard thing, but today was nothing but inspiration. It wasn't easy. We were still digging through, doing all the detailed work and taking care of people and taking all that damn PPE on and all. It was all, it isn't sexy stuff, but man, these two cases really filled me up today. Thanks for listening. I'm going to go have a beer with Gabe at his place. And tune in next time. We'll continue this conversation. I'm sure tomorrow there will be more stories to be told.